G'day, I'm Martin Laverty. I'm coming to you from Old Parliament House at a time where the nation is deciding who to elect to sit in New Parliament House. And over the course of the 5 weeks of this election campaign, we at Catholic Health Australia are going to be using YouTube to make some commentary and observations as we seek to contribute to the policy debate that should be occurring in this federal election. The National Health Performance Authority has revealed that 1 in 10 Australians put off seeing a doctor over the last year. The ABS similarly says that just about 10% of the population have avoided seeing a doctor. That's up 36% from just 2 years ago. We also know that over the last 5 years, seeing a doctor has actually increased $30 by way of an out-of-pocket cost. Medicare pays part, but the average consumer will pay $46.50 out of their own pocket to see a general practitioner. We think that this is causing strain on our health system. We think it's time to mend Medicare to ensure that we actually have a universal access to the Medicare system. So today, together with the Australian Nursing and Midwifery Federation, the Consumers Health Forum, our friends at the Mental Health Council and the Public Health Association of Australia, we've announced a plan to mend Medicare. We're calling on both the government and opposition parties to make a pledge during this election campaign to look at improving the 30-year-old Medicare system. We're wanting to focus on equity and fairness to ensure that those 1 in 10 Australians who might be putting off seeing a doctor because of out-of-pocket costs actually have the opportunity to receive access to the healthcare that they want. Because we know that if someone puts off seeing a doctor, inevitably they might turn up in an emergency department or joining a queue for public elective waiting surgery. With elective surgery times having increased over the last 5 years by 2 days from 34 to 36 days, and by emergency department waiting times also only improving modestly, we think action on health policy needs to be committed to during this election campaign outside of the hospital system. We call on all participants in the federal election to mend Medicare.